Okay, good morning. So we're very happy and honored to host Professor Desmond Runyon with us today. And we thank you very much for making the long trip all the way from Colorado. We're quite far, although I hear they have similar weather, so at this point. Anyway, Professor Runyon is a pediatrician, and he's been working in the field of research about child maltreatment for almost 40 years, has done many studies on this issue, including very important international studies. I said I would mention, I was just glancing through the CV, and I noticed a grant for $36 million. And I asked if I misread the number. No, it's quite a bit more than our typical studies.
We spent it all, too.
Okay. So we really, this huge wealth of knowledge and experience that we can learn from. I also want to mention that Professor Runyon is the first visiting researcher in a joint collaboration that Brookdale has now begun with Haruv, and we thank Asher and Haruv for this opportunity to bring over researchers from various areas and to enable us to share in their knowledge and their experience, to gain wide exposure and to be able to have a dialogue between the work that's being done here and the work that's being done abroad. So we anticipate a very productive collaboration in this area. And now, without further ado, I will give over the microphone to Professor Runyon. Thank you very much.
Well, it's great to be here. You have a beautiful city and country. I've enjoyed, this is my first trip here, but I've enjoyed it so far, and it's been a great welcome. I think I have a microphone, so I thought we have a little bit of time and we can have conversation about research. I thought I might start by asking if any of you are currently doing research on child abuse and neglect. Are any of you? Most of you? Well, hopefully I am not saying things. I'm a pediatrician, not a social scientist, although I play social scientist on TV. So I have, hopefully I'm bringing some new things to you or ways to think about it, but we can engage in a conversation. I was going to tell you about some survey research work I've been doing, but I've also been engaged for 20 years in a longitudinal study with 1,354 children in 5 different cities in the United States that we've been following now and wrestling with all the problems of longitudinal studies in this case. And so I certainly can divert and talk more about that if you'd like, but I thought I'd start off with some of the survey work that we've been doing. I'll jump right in. So the problem is that we have official statistics in the United States that tells us how much child abuse there is. But that's like knowing how fast people drive by how many speeding tickets they've gotten. It depends on what neighborhoods and what kind of car they drive and what color it is, and there's all kinds of other characteristics that determine whether you're going to be stopped, besides what you've actually done. And the same thing happens, as you all know, in child abuse. If you live in a crowded neighborhood, if you live in a building where your neighbors are going to hear your children screaming, you're much more likely to be caught than if you live out in a rural area far away from anybody else. And if you look like you're a member of a social group that people think abuses children, they're much more likely to be suspicious and turn you in. Or if you go to a government hospital versus a private doctor's office, all kinds of different known biases about who shows up. And so official statistics don't really represent the extent of the problem. And so the question is, how do we figure out how much of a problem there really is? And social scientists have learned for a long time, sometimes you just ask people and they tell you. They tell you about amazing things. So in the United States, we know that if you're black and poor, you're more likely to go to a county hospital. If you go to a county hospital, you're more likely that the doctors will if they see something, be suspicious and turn you into the authorities for an investigation. And those biases are well described. On the other hand, we also know from other survey work that poor families have tougher time and lots more stresses and may in fact react more to a child that's crying or to a child demanding toys or food or something that they don't have. And so there may be some real risks for being poor in addition to just the risks of being suspected more commonly. one of the problems that we had in the United States in thinking about doing survey work is we have mandatory reporting in most of our states. In 48 of the 50 states, there's mandatory reporting that covers physicians, and in a number of the states, it covers everybody. In 22 states, anybody suspecting a child has been abused or neglected is required by law to report it. And so that makes it complicated if you show up in someone's house and you ask them things and they disclose. But the ethics of going to someone's home and asking them to participate in research and have the gift relationship of research, and then in turn turning them into the authorities for participating and sharing, is complex. We're not intended to be the public health surveillance to capture people who haven't otherwise done it. On the other hand, it's not easy to walk away if you hear of something going on. And you hear of a child in need to turn and walk away. So it's a real ethical issue that we struggle with. And so we can come back to that because I'd be curious about your responses to how you would do that. We know that in the United States, these are the data from the official statistics in terms of, and these are rates of number of children per thousand that get reported in the United States. And it peaked in 1993. And then Bill Clinton came into office and fixed everything. And the numbers came down all the way, and they've actually continued to decline. And it's now actually, the more recent data is down about 10.3. So we actually have a pretty dramatic reduction, which is a big change. For when I started in this field in 1974, we could rely on every single year their statistics were going to show it was a bigger problem than it was the year before. But 93 is 93 is an interesting time because it's also the peak for the divorce rate in the United States. It's the peak on the crime rate and the peak on intimate partner violence. And intimate partner violence has declined by 63% in the United States since 1993. According intimate partner violence or domestic violence, it has declined by 63% in the United States since 1993. And there are all kinds of reasons as to why that might be. I think it probably is really, there are people that debate that it's just flaws in the survey methodology. But it actually may be related to this because our longitudinal data suggests that if there's domestic violence in the home, there's a 44% increased risk of a child abuse report in the next year in that same household. And it's not just the same perpetrator who perpetrates against the woman. The woman actually perpetrates more physical and emotional abuse on children who's a victim of of domestic violence herself. So the reductions, it may be that most of this, it's probably a discussion for another day, but most of this decline may in fact be due to the decline in domestic violence and not anything that we in the area of child abuse have succeeded in doing. So all states send their reports to a contractor who pulls the data together for the official United States summary. And the state laws are different, and they have to spend some time kind of reconciling the different kinds of cases and terms and puts it together. And then every year there's a summary report issued by the U.S. government in April that describes data from the prior 2 years. I mean, from the 2 years previously, because we're always about a year and a half, almost 2 years behind in terms of doing it. But so in 2007, 5.8 million children were referred to social services, 3.5 million were investigated, 1.4 million actually received services, but only 794 were judged to have been maltreated. And those numbers are, as I showed you, declining. Face-to-face surveys in the United States have been done. David Finkelhor and Murray Strauss and Richard Gellis did family surveys in 76 and 85, and then I helped them with the survey that was smaller, but we did in 1995 with the conflict tactic scale, finding out what people are doing. And the rate, let's see the important points here. We get fairly high participation rates. We can weigh them to the census data. And we came up with a figure of 3.8% or 38 per thousand, hitting with an object other than the buttocks, and 4.4% for harsh physical punishment. Those numbers are about 10 times higher than the official maltreatment report numbers for the country. So people tell us about more. It also tells us something about the importance of prevention. It tells us that we really need to be working in this area because we're not going to grow Child Protective Services tenfold. we're not going to have 10 times as many social workers responding. So we really have to decide that we're going to get serious about prevention. So after having worked with Murray Strauss and David Finkelhor in '95 for the Gallup poll survey, I had wanted to do this in the United States and in some other places, and we did a version of a study that I talked a little bit about yesterday with a different audience, and I'll come back to and talk about more. But we were interested in getting some population data in this century on what was happening in North and South Carolina. And our purpose was to evaluate a prevention program, to get some baseline data for a prevention program in the state. Because of the reporting laws, we couldn't go into people's homes and do the same kind of survey that our colleagues had done in other countries that didn't have reporting laws. We couldn't see them face to face, as I said, ethically. So we developed a computer-assisted telephone interview that we would call up, and we would survey mothers and ask them about what they or their partners had done with the children. We actually programmed the computer-assisted telephone interview to lose the phone number. I mean, as soon as the interview was started, that would disappear off the screen, and the interviewer couldn't call it back, so that there was no way the interviewer could then hear that they were shaking their child and then get the phone number and do a reverse trace and try and find the household. And we wanted to make sure that we weren't violating state and federal law, so we actually worked with the Attorney General's office for our state to make sure that this was a system that they were okay with. We started with a telephone survey in which we purchased. The survey companies will sell you telephone numbers of households that have children for a price. And we thought that might be a good way to go. And the advantage to that is that you don't spend as much money talking to people's fax machines and to businesses and other things. And since every one of those contacts takes a lot of money, it dramatically saves money to buy working numbers. So we started with that because we didn't have the budget to do a survey with true random digit dialing. But we found that that there was almost no low-income families in there, and it turns out that they get their numbers from people who buy, from Amazon and from other kinds of places, and so it's a biased sample in terms of income. So we actually developed a second sampling frame of true random digit dial for about 30% of the sample, and then we were able to weight it to get back to the census data. And we had a dual sampling frame, and fortunately we had some statisticians who could cope with this because this isn't my area of expertise. I like to say I'm a poor simple pediatrician when it comes to the statistics, so I get professionals. And we used the demographics that we collected and compared it to the two-state population to weight back. And we were interested in the parenting behaviors of the mother and the parenting behaviors that she reported of the father. The reason we didn't survey fathers in this survey is because we were also asking some questions about domestic violence. And we were interested in not making the women themselves subjected to violence for having disclosed domestic violence. And so we were trying to protect our subjects. And so we used female interviewers. We only talked to the women. And we asked them what their husbands or partners had done with the children as well. So it's not primary data from them, and they may have missed some important data from that. But we really were working very hard to make sure the women weren't put at risk for participating in the study. And we had done the same survey, and I can talk about that internationally, in other countries, face-to-face with women interviewing mothers to find out how children were disciplined. And we also looked at the social environment. We were interested in the concept of social capital and the social connectedness and network, and so we collected data about their neighborhoods and their connectedness as well. So of the mothers were asked to identify a child. If they actually identified all the children, then we randomly selected one to talk about because we wanted to be able to talk about 2-year-olds, 3-year-olds, 4-year-olds in the sample. The mean age for the children in the sample was 9 years. They ranged from 0 to 17, 51% boys, and 95% were biologic children. In our sample, 79% were Caucasian, 15% African American, and just 1.3% were Hispanic, which is an underrepresentation of Hispanic in North Carolina. We had to weight back up, and actually a little bit of an underrepresentation of of African Americans, so we're also weighted back. Most of them were married. 31% had high school or less. 39% had college or beyond. And incomes were stratified so that about 55% were more than $50,000 income, but 11% had less than $20,000 a year of income. In welfare, 17% were receiving medical assistance to pay for the medical care bills of their children, and 7% were receiving supplementary food called WIC, or Women, Infant, Children Program, to provide formula and food for young children and pregnant mothers. The instrument was based on the conflict tactic scale, although we had modified it in our work with our partners in other countries to add some extra items and to change it. And it was a precursor of what's now known as the ISPCAN Child Abuse Screening Tool for parents. We used partners in different countries to modify it and add some questions and to modify some questions to make it more universal. We used the original conflict tactic scale response range. It was up to 20 times. The ISPCAN instrument, we truncated the response item to never once, 2 or 3 times, more than 3 times, to simplify the translation issues. But we went back to using the original scale response items that Murray Strauss and his colleagues had developed. Okay, sure. The conflict tactic scale is a questionnaire that starts off. It says all parents have a need to change their children's behavior, teach them right for wrong. I'm going to ask you a series of questions of things you might have used in the last year, and tell me if you've used each of these. And then the response items are, 1 time, 2 times, 3 times, up to 20 times, more than 20 times, or I've done this but not in the last year, or I've never used that technique. And it asks, and it escalates. It asks about positive things like distracting the children. It talks about yelling, and it talks about spanking and hitting and slapping. And our variation also included some things that aren't in the original instrument, like pinching, which internationally was more common in the United States, or slapping on the face. And so you can see that 45% of the parents said they had spanked their child in the last year. These are the sample. We had a sample of 1,345 mothers in North and South Carolina. And 45% of them said they had used spanking in the last year.
Not only the children who have used,
all the children. This was not, the strategy here was to look for harsh punishment in the community. Yeah, I'm happy to take questions. Good. I'm happy to stop and take questions. So, and then 25% of parents said they had used an object on their child's buttocks, a belt or a switch. 6% had slapped in the face. 6% had pinched. The joke I made yesterday was that 25% of parents lied and told us they didn't yell at their kids. 85% said they had taken privileges away, and 79% said they had used timeout as punishment.
So what time frame?
This is the last year.
Last year.
In the last year.
what is timeout?
Timeout is where you put them in a corner for typically a minute per year of age, and they have to go sit in the corner and not talk to anyone and be shamed. So is that something that people use here? Yeah. It's what we found in our international studies is it's a relatively American pattern. It's not something that gets done in other countries quite so well. But then we classified a group of questions as harsh discipline. And these were intended to be our measures of what we would regard as abuse. And state law differs in different states, and also the other state law requires that there be consequences, so a child has to have been harmed by it as opposed to just the behavior. But we thought these behaviors were not something that we want to encourage, and we counted these as abuse. So overall, it was 4.3% of our North and South Carolina parents who used something that was abusive. Shaking a child under the age of 2 to quiet them or discipline them was 2.6% of the children under 2. Beating was pretty uncommon at 0.3%, and that was defined as hitting them over and over again with a closed fist. Burning was just 0.2, kicking 0.3. And hitting with an object on the child someplace other than the buttocks was 3.4%, which was the most common of the harsh punishments. And we asked about choking and kicking and knocking down, and unfortunately no parent, well, the kicking was 0.3, but nobody told us they choked their child. So fortunately, and the good news is these numbers are lower, dramatically lower than they were in 1977. And the South, where we did the study, is usually the harshest, has more harsh punishment than other parts of the country. Yes?
To what extent is when you ask a parent whether to be spanked, you use the spanking word. Would a parent look at, do you think, as spanking and would say, I spanked, I didn't hit? Do you understand?
Yeah, just the nuances that, and of course, it gets even more complicated because some of our families took this in Spanish, and the translation into Spanish. I mean, we think we know what spanking is, but then when you translate it into Spanish, it's a different set of words, and that means so. Admittedly, there's some confusion about that, and we didn't take a lot of time to clarify each one of these unless they asked the question about what do you mean by that. But spanking, we typically, when they asked us, we said with your hand on the child's buttock. Yes.
You said it's abused with numbers of decline.
Yes.
But I wonder whether they have declined or that it's not politically correct to say that you hit or beat whatever your child.
There's a,
Yes.
less appropriate to tell people that.
Right.
Well, that's true, but I've spent a lot of time talking with Murray Strauss and the people who did the earlier studies, and people challenged them as to whether people would tell the truth back in 77 or in 85 and 95, and they found actually no difference between telephone and face-to-face in terms of disclosure. It may actually be a little higher on telephone, which we did this time. Mm-hmm. And it may not be right, but but it probably is a better representation than official statistics. And the question of whether it's changing over time, and we used some focus groups to try to learn that, and people didn't have a sense that this was particularly scary. I don't think, at least in North Carolina, spanking your child is not socially prescribed. I mean, proscribed. I mean, people feel like it's an appropriate thing for them to do. I mean, it's not culturally. It's not. You don't get into trouble for spanking your kid.
Yeah, not just spanking, but also hitting with a belt. I think it was more...
25% told us that they hit with a belt, which is a pretty high number. Pretty. So people didn't seem to be embarrassed about telling us that. So we looked at it by age, and there's some interesting differences. Actually, and I'll show you some number, but 80% of children are being spanked by age 2. In terms of the abuse issues, this harsh punishment, the really harsh punishment in the first 4 years was 2.8%. At 5 to 8, it went up to 5.3, and then the 9 to 12-year-olds, where the children have the mouth that can really respond and make their parents angry, seemed to be the peak rate, and then after 12, it dropped again. For gender, females were more likely to be hit than males, which a lot of people were surprised at. We actually have some other interesting data that we looked at suggesting that mothers hit daughters and fathers hit sons. And so there really is gender stratification by discipline, a remarkable gender differentiation in terms of who does the punishment. And mothers overall did more of it than fathers. Some people are surprised at that, think that child abuse is a testosterone poisoning. But on the other hand, mothers are the ones that are with the children all the time and are responsible for raising them. We did the similar study in India. We did some focus groups ahead of time, and they said there's no point in even asking about what fathers do for discipline. It's not a father's job to do discipline. We did actually ask the questions. It turns out fathers do a fair amount of discipline in India, but the common public lore was that they didn't. Which actually leads me to another observation. The focus groups, we've done focus groups on discipline as well, and the focus groups differentially pick up the kind of salacious stuff and kind of make it sound like that's really a big issue. For instance, in India, the focus group said, well, you need to ask questions about tying the children's hands or feet together and hanging them up off the ground with the ties. And after we got over a shock of that, we actually did a pilot study where we asked those questions, and it turns out they're exceedingly rare. I mean, we did get a few people telling us about that. But the focus group made it sound like, oh, this happens all the time. You really have to ask about this. And the good news is it was less than 1% of the kids had this happen. So it doesn't happen all the time. So it was kind of, for me, a lesson in terms of one of the dangers of focus groups is that some things that are dramatic and get your attention are the kinds of things that focus groups will talk about. So we looked at it by age, and actually, the numbers, more recently, we've been looking at spanking. It turns out that in North Carolina, 80% of 2-year-olds are spanked. But overall, across the first 4 years of life, and I guess protected by the younger kids who weren't being spanked as much, 57%, and then it went to 70, and then it dropped down to 50, and then 13 to 7-year-olds don't get spanked very much. Spanking with an object, again, peaked in 5 to 8-year-olds. Hitting the children with an object, again, the same time. And it looks like the 9 to 12-year-olds, they've learned to speak back to their parents. They're a little bit, they're small enough that you can do something to them, and their mouths work. And so the mouth is the offending organ. And teenage, actually, slapping in the face is more common. Yes. On the buttock, right. That's not included in spanking. Yeah. We actually asked a question about slapping on the face or hand, and slapping in the face, and we also asked about slapping elsewhere in the body, and that really wasn't used all that often. So there are some interesting things. You notice that the slapping is relatively uncommon. When we did our survey, we did a similar survey face-to-face and with a large sample in India, and slapping on the face was more common than spanking in 11 of the 14 communities that we did in India. So very culturally different. In the Philippines, threatening a child with a boogeyman or evil spirits was really common. There was a lot of corporal punishment, more so than the United States, in terms of hitting with an object in the buttocks and hitting with an object. But there was also threatening with evil spirits of the boogeyman. So there were very interesting cultural variations in it. And one of the questions that led us to was, does the meaning of the discipline change? I mean, in the United States, because slapping on the face is so rare and it's insulting in a way that it may actually have a different emotional connotation than slapping on the face or the head in India, where it's common and you see it happen all the time, or threatening with a boogeyman in the Philippines, where it may be something that kids all laugh about because that's something adults share and say to each other, everybody says, and if somebody said that in the United States, it would be a pretty remarkable, because it doesn't happen very commonly, and so that a child may have never heard another adult say that, and it may have a different context. So, yes?
We've done surveys to youth asking about punishments, and some of the youth speak about other things you haven't mentioned. I'm just wondering if it came up. For instance, kicking you out of the house, making you stay out of the house, or denying meals.
We have questions on those as well. I didn't put them in here. They weren't that common, but abandonment is one of the issues, that the threatened abandonment and abandonment were one of the issues that we talked about in the report that we published on this. So we actually published our international data in a year ago in the fall, so that would have been 2010 in pediatrics. So we also tried to ask about neglect, and there's really difficult to try and figure out how to ask about neglect because it's different by different ages, and they're trying to come up with a few questions that you can ask in this kind of survey that capture neglect. And so it's really just a little snapshot about neglect. But we asked, for instance, in the past month, were you not able to make sure that this child got the food he or she needed? Trying to indicate that there was both a need for it in the child. So simply not giving the child the cookies that they wanted was not counting as neglect. But if the parent thought they needed food and didn't give it to them, we thought that could be counted. And we asked in terms of responses, and we asked similarly in terms of medical care. But this is the food, and these are per 1,000 children. And so there were only 19 children who, in the past month, out of 1,000 children, who had not gotten the food that the parents thought they needed. So just 1.9%. Little difference in the states, but not statistically significant. And we asked in the past year, and it was about 3% of the children. So not terribly common, but and interestingly, the exact same in North and South Carolina. We stratified by that. And then we asked a question about leaving a child at home alone for more than an hour. Of course, this is very age dependent. I mean, and at what age is it okay and not okay to do that? And I think I have a graph here that will show you kind of what the responses for that were. But this was actually more common, and 3 to 5 times a month was something that we tried to play with. Well, what if we said it was kind of more habitual, and that might count as neglect, where it's just one time. There might have been an emergency, and then So you can see that we kind of tried to alter the definitions and see if that changed, and it still ended up being about 23% of children had been left 3 to 5 times alone a month in the last month. Well, that's the problem. We were asking up until 18, and so I'll show you I think I have the curve here. This is the curve. So age matters, and the red is home alone, and so you can see that basically nobody endorsed it, or virtually nobody endorsed it up until about through 7, and then age 8 and 9 started seeing a little bit of an increase, and then obviously lots of teenagers are left home alone. So what that tells us is that I mean, if we were going to try and set a standard for kind of what that is, below 7, leaving a child for more than an hour is something that is socially an issue. And then we asked another question: if was a child hurt when an adult should have been? Did your child get hurt sometime when you should have been there, or an adult should have been there and could have prevented them from being hurt? And we actually found a pretty high number of kids in the first group. We thought pretty high of kids who've been hurt when left alone, or parents had not been supervising. But we don't know. We just said hurt, so we don't know if that was a cut or a bruise or a fall off a jungle gym, but it was an attempt to try and capture some sense of what was going on for neglect.
What do you mean 900 out of 1,000?
Big pardon?
900 out of 1,000. What does this mean?
That means that these are percent turned in. Basically, we weighted it to the rate per 1,000 children, and so leaving your child home alone for more than an hour was 900 out of 1,000, roughly 90% of children, teenagers were left alone for more than an hour, which one could argue that the ones that didn't are probably the abuse at that point. That probably is the problem. If you can't leave your 17-year-old home alone for more than an hour, either you or the 17-year-old have problems.
I was wondering if there's a law in the States that trying to prevent child.
It's one of those things. It's not a law. But social services struggle with this because trying to figure out what the right standard is. And so I know in North Carolina, where I was living for many years, the Durham Department of Social Services came out with a policy statement saying that no parent of a child under 8 should leave their child home alone for more than an hour. And there was a firestorm of letters to the editor in the newspaper and a lot of complaints that social services didn't understand what people's lives were like and that was an impossible standard. And of course, where you live and what kind of the dangers you can get into and whether you have extended family around, there are lots of other things that make it very different. And I suspect we'd have the different answers in different countries as to what's okay and what's not okay in terms of that. You may have heard, I think it was probably about 8 or 10 years ago, there was a couple from Britain who left their child in a stroller outside, I think it was a Starbucks in New York. They put the stroller outside and went in for coffee and were sitting inside and the baby was in a stroller outside and Child Protective Services was called and the child was taken into custody for being neglected and there was a legal battle about it. So we clearly don't have good answers to what's okay or what's not okay. But it is interesting that I suspect in North Carolina we wouldn't have any trouble complaining about a child left under 6 being left at home alone for more than an hour. And then there appears to be more public acceptance of that. So it's one way of kind of getting an answer to kind of what the standards should be. Other questions? So the other project that shaken baby syndrome is something have all of you heard of shaken baby syndrome? It gets lots of attention. It's actually on the scale of close to 1 million kids a year in the United States being substantiated for child abuse and neglect. We have about 12 to 1,600 shaken babies. So it's a minuscule part of the problem from the standpoint of Child Protective Services. But it gets a lot.
Just referred to actually a baby being shaken, or is it a code for abuse?
It's a type of abuse in which a child is shaken back and forth and they end up in the hospital with hemorrhages on the brain and sometimes with bone fractures and rib fractures. And about 22% die of the ones that are admitted to the hospital. So it's a serious condition, but it's a relatively small condition from the standpoint of officially getting in trouble. What's interesting is that when we surveyed parents, you saw the North Carolina data, 2.6% of parents said they had shaken their child under 2 to discipline them. and the rate of, but we've been doing active surveillance, which I'll share with you. There are 10 pediatric intensive care units that hospitalize children in the state of North Carolina. And we made the assumption that if a child had shaken baby syndrome with the intracranial hemorrhage, that most doctors were not going to keep them in the local hospital or care for them themselves. They were going to dump them onto an intensive care unit. So that we thought that between the medical examiner's office for children who died and the 10 intensive care units in the state, we'd have pretty much 100% ascertainment of every child in the state of North Carolina. And we actually did an extra, prior to the project, we went to the intensive care units in the surrounding states of Virginia and South Carolina and Tennessee and Atlanta and Georgia to see if they had any North Carolina residents who were children with shaken baby, to just make sure we hadn't missed any. And we actually found 3 additional ones in our surveillance. And so we called each intensive care unit every week to ascertain whether they had any children, and we didn't define it as abuse. We asked for traumatic brain injuries, children who were there because they had hemorrhage on the brain or a skull fracture and were in critical condition. And then we collected data about them, and we asked the hospital how it happened. We also had a juried process where we had blinded review, blinded by socioeconomic status and race, and they had the case reviewed by a panel of 3 pediatricians who concluded whether the history was plausible. Did the child really roll off the couch, or or something happen? And reviewed each of those cases. And we calculated through. We had 154 children over 2 years that were hospitalized with injuries, of which 80 were intentional in our judgment, and 74 were unintentional in the first 2 years of life. And that calculated out to 30 per 100,000 live births in the first year of life, and just an eighth of that, or 3.8 per 100,000 children in the second year of life in the state. And if you lump the 2 years together, the first 2 years of life, we came up with a 17 per 100,000 rate of shaken baby syndrome, which this was actually the first population. We published these data in early, I guess in 2003. It was the first population-based surveillance of shaken baby syndrome. But interestingly, the number from Estonia turns out to be about the same. And Wales and Scotland have done studies, and they're about the same. So we seem to be a number that's kind of right in the middle of where other people are finding that. So you've probably already done the math in your heads. 2.6% of the population saying they shook their kid, and 17 per 100,000 the first 2 years of life actually being shaken baby. That means there are 150 kids shaken by a parent for every kid who ends up in critical condition or dying from shaken baby syndrome. So actually that leads to one obvious question, which is what happens to those other 150? And are there complications or problems for those? Some analysis that's kind of interesting. The cases that come into the hospital, 70% are male perpetrators. It's mothers, boyfriends, and stepfathers and fathers. Female babysitters make up about 17%, and biologic mothers only make up about 13%. Interestingly, when we asked our population survey data, mothers actually shake more than fathers do. But in terms of shaken baby syndrome, there seems to be a big differential in terms of who the perpetrators are. We don't know if that's because the shaking is different, or whether it's just the average physical strength and how much force it takes to cause the damage. And that on average, shaking by a woman is less effective at causing permanent damage than shaking by man. Yes, Scott?
Did you try to control for the baby's age? Because I know there is differences between shaking newly born and 1 year old.
These were, right, but these were all in the first 2 years of life. And so we asked, the population survey, we looked and tried to see if that was there. We didn't find a first to second year difference. Interestingly, the 2.6% of kids shaken under 2 was almost identical to the 2.5% of children over 2 whose parents said they shook them to discipline them. So there didn't seem to be a dramatic drop-off in shaking for older kids, just probably a dramatic drop-off in the effectiveness of getting them, causing damage, because their necks are stronger, they're heavier, they're harder to shake vigorously. We actually repeated the survey of the young kids. We're involved in a process now. We use the 2.6% data to drive a public discussion about child abuse prevention, and this became a topic in which we wanted to work on prevention. So we actually pursued and got a grant from the Centers for Disease Control for Ron Barrs, a pediatrician at the University of British Columbia, who has talked about infant crying and how unresponsive...
He will be here in October.
Okay, well, so Ron's done work on unresponsive infant crying, and you've all probably... Unresponsive infant crying. You can't get them to quiet down. So some people call it colic, but if Ron's going to be here, I'll warn you, you don't call it colic. Ron thinks that every baby has unresponsive crying. Some babies do it for a minute or two. Some babies do it for 5 hours. And if you have a baby who cries for 5 hours a day, it drives you crazy. And as one mother said to me, I would never hit my baby, but he had to shut up, and I shook him. Because it turns out giving a child a concussion is very effective at stopping their crying. Giving them a brain injury, a concussion, stops their crying. But it turns out that people don't understand that's what they're doing. They get frustrated, they finally shake the kid, and the kid stops crying, and they think, boy, that worked. And so a desperate and uneducated mother who doesn't realize what she's doing may, in fact, you develop a positive feedback loop that if you can't solve it any other way, you shake them. And that may be explained why about a third of shaken babies have an evidence of prior injury at the time they get diagnosed. So we ended up repeating the survey of parents, but this time we did it a little bit different. We're testing to see this education effort called the Period of Purple Crying that Ron Barrs developed, whether preparing parents about crying would actually reduce the numbers of babies being shaken. And so we wanted a baseline data. And it was 2007 was when we were starting the study. And 2005, Mark Diaz had published a paper in Pediatrics about an education program reducing shaken baby in Western New York State. So and a lot of hospitals had started talking about shaken baby prevention after that paper. And so we needed to make sure we understood what the rate of shaking was. And the awareness of shaking is a bad thing. And so it turns out, what we did... Before I tell you the results, we did a baseline survey. This time, our sampling frame was different because we're interested in very young children, which we didn't have a big sample of in our big state study. We talked the State Department of Human Services into giving us a data file of randomly selected 25,000 birth certificates of children who were under 2. And then we took those names and addresses of the mothers, and a survey research firm called GenSys, for 50 cents a successful name, would take and find us a phone number for each of them. And they were able to match those to a phone number for about 65% of the birth certificates. And then we used that as a sampling frame for anonymous random digit dialing. And so we would dial up. And we had some mothers who denied that there was a kid under 2 in the household. So clearly the numbers had changed because we didn't actually know who we were talking to. We just had the numbers. But we did a baseline survey using that sampling frame, which had some real advantages because we could match to the distribution of birth certificates and do matching in terms of, and waiting to do it. And it didn't come from the GenSys people who'd used Amazon sampling frame. So we were able to get a more representative sample of the state. And we were interested in the changing of it and in whether it had changed since the earlier study, and also in a more accurate and precise estimate. So we used a sample of 3,000 parents is what we were targeting this time for kids under 2. We also wanted to know if they were aware of shaken baby syndrome, had heard any messages about it, because we were about to start a campaign, so we had some marketing issues as well. And then we began, after we did the survey, we began our intervention statewide. So we obtained 20,000 names from the state of children less than 2, and we did the same survey we did, and asking about spanking with an object and hitting. We had a few parents that were a little distressed that we were calling them up about their 6-month-old baby and asking if they'd used a belt on their child. And so we had to explain in a briefing that we were using a standard instrument that was for all children, and that the questions didn't necessarily make sense, and they could just say that they hadn't done that, and that was fine. As I mentioned, we had about a 60% sample. We used that as a sampling frame. And we did up to 10 calls to each number before we gave up on a number at different times of the day. And because it was anonymous dialing this time, because we didn't want to have to report people, we couldn't actually match to a birth certificate the data. So we did have some mothers that denied there was a kid that age, and it may have been a different child than the one we were originally intending to, because we just asked if there was a child under 2 and then asked the questions. And now, interestingly, actually, I jumped the gun. The baseline data in 2007, 1% of parents had shaken their kids. And then we just got out of the field repeating the survey now after 3.5 years of intervention, and it's now down to 0.5%. So, and part of the answer is maybe people have just learned to be smarter and not tell us they shook their kid, because we've done a good job of telling people that, and educating people that shaking is bad. The bad news is that the actual numbers of children who are coming into intensive care units is unchanged. We have exactly the same rate that we had in 2007. And I can't explain why we haven't seen more success in that, except that our numbers, the fact that North Carolina is no different, is positive in the sense that 2 papers have been published, one in Ohio and one from a collaboration of a bunch of children's hospitals in 5 states, suggested that with the recession, shaking of infants had gone up between 70% and 100% in different hospitals. And we didn't see any increase. We just saw the same rate. So the hard part is maybe we succeeded in blunting the increase, and how do we prove that we didn't, that's different. So we're actually continuing surveillance now as the state's coming out of the recession. We're continuing surveillance and through next year to see if we can find the numbers. Yes? The intervention itself was a video that was given to every new set of parents on a DVD and a booklet about infant crying, and a nursing education intervention that takes about 10 minutes about that normally babies can cry up to 5 hours a day between 2 and 4 months of age. And part of the message was it gets over. The children, by 6 months, generally it's gone away, so that it will end. They don't go to college still crying that much, or medical school or whatever. That it will get better, and that there are some things you can do. You can walk and talk and carry and comfort your child, and that will help. But sometimes nothing helps, and you should put the child down on their back in their crib and walk away and compose yourself and take some time before coming back. So this was a video message that was shared on a video and a booklet with every new parent, so both mothers and fathers. And the reason we gave the DVD is because we're concerned that mothers sometimes switch and have a different boyfriend living in the home, or a stepfather or somebody else that might be the perpetrator. Or it may be a babysitter. So we said, if you have a baby who cries a lot, make sure the babysitter sees this DVD before you go out for the evening. And so it takes about 7 minutes for the DVD and the booklet they can look at pretty quickly. And you can forewarn and forearm your babysitter or your grandparents, the grandparents or other people caring for the child, about how difficult it is. And that was thought to be part of the intervention. Yes?
What part is that? Is it probably the fathers or female alien? Because
Yes.
we had a higher rate of babies being taken by males who got into the hospital. But it could be the decrease. You know, if you had like more, if the womb was to take more affected by the tape somehow, then you'd have an all decrease in shaking, but not in the number of.
You're right. And we're still looking into this to try and sort it out. But this was the pool to guess what mothers and or fathers had done together. Yes?
I'll use the opportunity to update that a very similar project was done in Israel by the National Council for the Child. In my career role, I started it, but I didn't end it. And in October, there's going to be a national conference day when Ron Ball is coming, showing similar results, but in a much less rigorous surveys. We've done some polls in the geographic areas where they handed out DVDs. There was, maybe some of you even caught Mikhailovich doing some ads on "Don't Shake Your Baby" on the TV on various times where you're allowed to put free ads and things like it. And there is an education film for parents, and the results are similar. when people realize that it's bad, and most people shake their babies because they don't realize that it makes anything bad, and they think even it's good because you shake him and then he stops crying and everything is fine, and you need to educate the parents, and sometimes even go to another room, close the door, hear some music, let the child cry. It's better than try to shake him. So the results in Israel in the public opinion polling, in geographic region in the south where it was done, are similar. People report that they are more aware. We don't have any actual data on it in Israel. Yesterday, because in Israel, like in India and in other countries, the option to do an autopsy for a young child that dies doesn't exist practically. So we don't know what the pediatrician will tell you is that many of the kids who have died and labeled under the parasites, cradle death or whatever, kids who
SIDS or, yeah.
SID or whatever. Everybody, when there is an infant that dies, is automatically in Israel labeled as dying out of SID or Mavet Barisa, and nobody's dying an autopsy or checking or doing even an MRI to his head to see if there was any hematoria or something there. So we have, and this is similar to India, I understand, and to many other countries, the United States or some other countries in Europe, whenever a child under a specific age dies, you need to do an autopsy. The law is that you need to do an autopsy, and then you can realize what are the reasons for the death much better.
Well, to put this in perspective, we surveyed in different countries how people discipline their children, similar to what we did here. And we collected data in 14 communities in India. And we collected data in the Philippines and in Chile and in Brazil and Egypt. And I'm trying to remember, I think it was 10 of the 14 communities in India, more than 20% of the children were shaken by their parents under 2 years of age. And there were 2 communities, over 50% of children were reported shaken. And I've just been working with a woman from Bangladesh who's done a survey of discipline among young children from children who were, she has a captive population. She surveys the mothers of children who come to the diarrhea hospital in Dhaka. And she has, we're working on the publication now, over 50% of the mothers report using shaking to quiet their child. Which raises an interesting question about the consequences of shaking for children who don't get into an ICU or die. And do we lose some, is there learning disabilities, mental retardation, other kinds of consequences for some proportion of them?
Do we know?
We don't know. But we postulated if the numbers are 1 in 150 kids gets into trouble in the U.S. from parents who tell us they shake, and if we apply those same statistics to the India numbers of how many people told us they shook, and we said 1 in 150 is getting into trouble, either dying or having acute hemorrhage, that we could, and if for every 1 in 150 there are another 4 or 5 who suffer learning disabilities and mental retardation, we suddenly start explaining something on the order of 7 to 10% of the mental retardation among the poor in India could potentially be attributed to this form of discipline. That's a back-of-the-envelope calculation, kind of a postulate for kind of why it might be actually more important in other countries outside the United States to get interested in this infant shaking and its consequences. And that's all just back of the envelope. If it's 1 in 150 and another 5 out of 150 have mental retardation or learning disabilities induced by this, then suddenly those numbers start to get to be pretty significant. And so that's just a postulate. We've actually proposed in 3 different proposals to the National Institutes of Health to do the study, to take a look in places that report very high rates of shaking, like the slums of Delhi, to follow up on and see how the children are doing cognitively who are shaken versus not shaken, and have not yet succeeded in getting funded for that international study. And I don't know if this applies to your population. I'm just going to speculate. I mean, you have people from all over the world that come to Israel. You have poor and wealthy, and I wonder if you have data about shaking behaviors here, or people have talked about. Have people interviewed parents about shaking here? And do you have any idea?
There was 2 surveys, one before the intervention in the geographical region in the western Negev, western south part of Israel, and people that didn't have a clue about shaken baby and what does it mean, including we've done 2 surveys. None of them were as good as this one because they were done with a much smaller budget. But we've done one among professionals who didn't have a clue, and I'm talking about nurses, Tipot Halab, mother and baby well clinic nurses, physicians, social workers, most of them didn't have a clue about what it is, and parents. And after the intervention and a big public campaign, using the 2 hospitals that serves those areas, which is Soroka and Barzilai, those were 2 hospitals, and then we came back, and the rate of public awareness grew dramatically. Taking the rate of public awareness to the actual practice of shaking or not is another thing, and then taking that to the results is another thing that wasn't done yet. But it's becoming an issue in the public, in the professional discourse in Israel for sure, and it wasn't for many years, and it's becoming an issue also, a recognized issue among more and more people. But it's, I think, all over the world, shaken baby syndrome is a new thing.
Mm-hmm.
In the child abuse discourse, and it's especially interesting because it's even more than neglect, it's unintentional in many cases. You know, when we speak about sexual abuse, physical abuse, which many times is intentional. Shaken baby in most cases, it's unintentional. It's a practice of behavior, and therefore I think personally that it's one of those, if it's unintentional, the chances of changing behavior is the biggest one. But we need to invest much more.
It's a small part of the overall problem, as I said. I mean, if we have 750,000 children substantiated for abuse and neglect in the United States, and we have 1,300 shaken babies, I mean, it really is a very small part of the problem. But it may be low-hanging fruit in the sense that, you know, as physicians counseling you about your weight or about your smoking or about other things, we have not a great chance of getting you to eat less, when smoking is something that, if I find all the people I've counseled about not smoking, don't feel like I've had great success, because they'll stop smoking for a while and then go back to it, or they'll do better for weight control and then they'll go back to it, or they'll exercise for a while and they'll stop. But children are getting bigger and harder to shake, and so that if you actually can get a child through 6 months where their neck is bigger and they weigh more and they're harder to shake because they're just too physically heavy to do serious damage to, the likelihood of serious harm is much smaller. And so in some ways it's the perfect health education problem, because if you can change people's behavior for 6 months, the child's home free, or not quite home free. 19-year-old parents living 1,000 miles away from their extended family and on a base or in relative poverty with no resources around. So if we were going to design an experiment to get somebody to drive people crazy and make it so they got frustrated with their kids, putting them in the military 1,000 miles away from home with no social support is probably the perfect experiment. So we know some risk factors. Clinically, I've seen lots of shaken babies, but I've never, I shouldn't say never, I've only had one that was a second child. I mean, people learn the first time how to care for babies, but also if they've done it the first time, they're probably not a big public health hazard for the next baby, because they've learned it was not intentional, and they've learned that this is bad. And so relatively speaking, this is one that, unlike sexual abuse or other forms of physical abuse, this is one that is, as Asher said, is unintentional in the sense of unintentional in terms of the harm. I mean, it's intentional, I need this baby to shut up. But it's not intentional in the sense that they were trying to kill or damage their baby. So it's actually a different demographic than other forms of child abuse.
To ask a question.
Sure.
Is there some variance between different states? Some places where they shake a lot, and the other where they don't shake. Question number one. Question number two, do you know anything about creating situations so that the number of shakings is reduced?
Both good questions. So the first part is that when we did our international study, we took our 19 communities and put them on a graph by maternal education, years of maternal education. And the lowest rate of shaking in the world was 0 in Chennai, India, where the women averaged 15.3 years of education. And the highest rate of shaking was in the slums of Delhi, where the women averaged less than 2 years of education. and rural Bhopal, which was about the same, was very close. And the United States and Chile and Brazil all fit on the same line, and basically it's a pretty straight line curve. The more years of education, the lower the rate of shaking. And so there is a fair amount of variation, and opportunities for women and education for women appears to be the single most protective thing we can do.
But those who are most endangered to shake, what can you do for them? Except wait that the next.
Well, we're involved in this prevention program called the Period of Purple Crying that you'll hear from Ron Barr, I guess, in the fall. We've targeted military families, which appear to be at higher risk, and young families. And I didn't go through the full, so we give a DVD and a booklet to every new parent. The nurse is supposed to go through the booklet and DVD with them in the nursery, and then they go home with them so they can share them with other people. And it turns out about a third of mothers tell us in surveys that they've shared it with other people. We give a booster dose. We have the pediatricians and family physicians in the state have a card that reminds people about the core principles, and if they didn't get a DVD or booklet, they can order it, or some doctors' offices actually ask us to give them copies that they can give out in their offices. So there's a booster dose there. And the third dose is, we decided, given that the increased risk was for young parents, we did a radio campaign. We used the radio stations that preferentially get young parents listening to, so under 23 is the target demographic. And so we look for radio stations that men and women under 23 listen to, and we developed an education campaign that's to drive people to a website to get more information about shaken baby and the hazards of shaking, that we used in the state of North Carolina as part of our intervention trial. And we reduced the baseline rate. In 2003, it was 2.6%. Mark Diaz did his paper in 2005. Our baseline rate in 2007 was 1%, and our data that we just got back out of the field in the last summer, I guess in September we finished up, is now we're down to 0.5% of the children parents telling us they shook their child. So we've at least changed what people tell us. And have we changed what people are really doing? The jury is still out. We're doing another year of surveillance to look at cases to try and see what's going on. And we have enough DVDs and no-cost extension left in the budget to keep giving DVDs for a year. The radio campaign we've run out of.
You said there's also a broader contribution, helping parents deal with babies crying more broadly, even if they weren't going to end up shaking them.
Well, and it's
all kinds of just the whole emotional relationship, etc.
Well, it's interesting you say that, because it occurs to me the other thing I didn't tell you is the University of North Carolina in North Carolina runs an after-hours nursing call system in which doctors' offices can send their after-hour calls. They can contract for the hospital. All over the state, people contract because it's by telephone. So they call in, and the nurses answer the calls and can triage and decide which ones they need to call the doctors on. And they keep a logbook of a database of all the calls that they get for after-hours calls across the state. And we can show that there's been no change in overall numbers of doctors' calls since 2000 to 2010. But after we started our program, there was a 21% reduction in calls for infant crying in which no fever or any other symptoms were mentioned. It went from 6 to 4% or 6 to 4.5% of the calls in the database each month. So we could show an actual reduction in people calling the doctor's office about infant crying. Depending on whether the cup's half full or half empty, one could decide that's good because people know how to handle their infant crying and don't call the doctor's office. Or maybe the other side of it is they shake them more, they're not getting help for their kids, or they kind of blasé. I mean, we have a colleague who complains about the period of purple crying not being adequate, and who uses those data to interpret that things are worse, but we think they're better.
Maybe they understand crying is a normative thing for babies, because you said the video explains that a baby could cry for a couple of hours.
Right. So basically, I mean, the hazard might be that a child who does need to get medical attention isn't taken because the parents have been falsely reassured. So that we've certainly been conscious of that. We don't think that's happening. but that's something we've paid a lot of attention to, and so we've actually altered our message to include kind of signs and symptoms that they can turn to, and of course the nurse's triage system can help say you need to take this child to the doctor. But we did actually worry about unintended consequences of a child who's crying because they have something wrong not being taken to the doctor. But it's been an interesting experiment to try and do this on a statewide basis. And probably all of you, since you're researchers, are saying, well, why didn't he do it as a randomized trial? And we actually tried to figure out how to design a randomized trial. But how do you educate some mothers and not other mothers in any kind of randomized trial without having crossover, especially when you're giving them a DVD and a booklet? And so we made the decision that, and the other part of it was statistical power, that if we cut the state's population in half and did compared the east or to the west, we end up having a much fewer number of cases, and it would be not enough statistical power to prove significance. So we ended up making a decision to just do it as a before and after design as opposed to a randomized trial. We struggled to try and figure out how to do it as a randomized trial and just couldn't figure out how to make it happen. So those are the kind of major projects I have. Let's see. Oh, this is. These are the data from the survey that showed something else that we thought was interesting, and we've published about this now. We created what we call the spanking curve. It isn't really a curve because it's cross-sectional data. We just look to see what the rate of spanking for children at different ages are, using our method of birth certificates to do the sampling. And because it takes about 3 months of age for a child's birth certificate to kind of get registered and be available for sampling, we didn't have a lot of in the first 3 months, we basically started at 3 months because we didn't have birth certificates before then. But a couple things are worth commenting on. We had 6% of babies in the first 3 months of life were being spanked already. And I thought that was pretty remarkable because I can't think of anything that you could teach a 3-month-old by spanking it except how to cry louder and be even more frustrating than before.
So it's a symptom.
Beg pardon?
So it's a symptom.
Yeah. So, but we thought it was pretty remarkable that 6% of parents would think about spanking a baby under 3 months of age.
So we define spanking by a person, a child on his buttocks at the age of 3 months. You call it spanking?
Yes.
Okay, so
we now call it abuse, but we ask the question of spanking. Well, so it's the same question.
If I understand, this whole set of phenomena that you're describing, and you're not saying by calling it spanking that it's not abuse or is abuse. Within this whole menu of behaviors, a certain ones are then, depending on who and when and what state and what person, what authority defines it as abuse. So we're not saying anything about abuse or abuse. We're just describing the phenomenon.
Well, and as a pediatrician, I was taught that there's no point in having a discipline discussion before 9 months of age because people don't discipline before 9 months of age, and you want to catch them before they start disciplining. So the discussion about to spank or not to spank and how to do discipline happened, I was taught, as a 9-month phenomena in the well-child check. And what these data tell us is that 25% of babies are already being spanked at the time I'm having that discussion. And I didn't know that. Probably I should have been asking that, but it didn't occur to me that people would be spanking children that young. And then the T50, time to 50% of children being spanked, is about 15 months of age. That by 15 months of age, half the kids are being spanked. So those are, and this is one state, and it's the southern part of the United States, which is relatively, spanking is viewed as a good thing there. So they weren't embarrassed about it, and we didn't find people acting embarrassed about telling us that they spanked. This is something that they do. Yes?
Maybe these results can explain the results on shaking babies and why maybe the intervention didn't really work because maybe they are shaking them for other reasons, even if they know that's harming them to do it, because 25% are practically abusing them till 9 months.
No, and one of the questions, are these children crying and is this a prelude to shaking them as you spank them? I mean, you try that first and then they cry louder and then you get really frustrated and then you shake them. So it may be that it's the same trigger. We're also looking at the age patterns for fractures in young children too, and it turns out that the same crying period of 2 to 4 months of peak crying that Ron Barr has talked about seems to be the same peak time for fractures in kids and intracranial hemorrhages. So it's a very tough time for parents.
Can't you recruit parents who don't? Can't you recruit parents who don't spank to help other parents not to spank?
I think that would be one strategy. I mean, first of all, we have to kind of get to the point where we think that spanking is bad and not in.
Oh, well, I'm not recommending that one.
No, yeah, I think. I mean, the first battle is to try and change norms in terms of what's okay and what's not okay. And we have a lot of spanking that we think is perfectly okay, particularly in the South.
Let's not take spanking. Let's do shaking.
Shaking, you're right.
So some parents are not shaking. Well, can't you use them in order to help other parents not to shake?
Yeah, I think. I mean, there are a variety of educational efforts recruiting parents and having a community participation is probably a very effective way of disseminating it, disseminating the not shaking.
Anything written about that?
Not to my knowledge.
That's never too late.
So it sounds like it's a project for here. So I'm one of my messages is to, and you folks as social scientists think about this all the time, but for pediatricians who think about clinical work and who's in clinical research and who's at the hospital, I encourage them to kind of take a more sociology view. And I had the luxury of, in 1995, I took off my white coat and stethoscope and went and spent 6 months with the sociology department at the University of New Hampshire, Murray Strauss and David Finkelhor in the Family Research Laboratory, and got to act like a sociologist for 6 months instead of a pediatrician. Fortunately, I still remembered how to do pediatrics later, but I discovered sociologists have a lot more comfortable lifestyle in terms of blue jeans. I think of this as a way of, I mean, people who get caught by Child Protective Service is a little bit like getting caught for speeding. I mean, you did it in the wrong place, and you had a flashy car, and and it doesn't necessarily relate to who's actually speeding. It relates to who's driving a car that's red and in what neighborhoods they drive or what streets they drive on, and if they go past schools at high speed versus other places. The nice thing about these surveys is you can really dramatically increase sample size, and so that it's a lot easier to get adequate populations on telephone surveys than you can do, and it's a lot less expensive because you can let your fingers do the dialing, as long as you can come up with a system that doesn't mean that you don't dial businesses and fax machines and all the other machines that aren't working. And we estimate that we can do about 3,000 interviews for about $90,000, which is dramatically cheaper than face-to-face, and so it really has some major advantages in places where people use telephones. The hardest part is now in the United States is that directories don't exist for cell phones, and the numbers in exchange. And in the United States, we charge people incoming. If you get incoming message, you pay just like you do outgoing, and so it's no different. So you're costing people actual money by dialing their cell phone. So people are a little reluctant to give out their cell phone numbers. So you have to figure out ways to give them incentives that basically reward them, like with cell phone minutes or things like that, with companies to get them involved. But that can be done, and we're spending more and more time doing it because many young people, including my own son and his wife, don't have a landline anymore. The only phones they have are their cell phones. It also has some interesting implications for the kind of work we did in terms of calling up parents and asking about discipline, is because typically it's two different numbers for the husband and wife, and you may get very different answers. And trying to ask for the wife in the context of getting the husband and getting the husband's number, it may actually be a problem. So one has to think about both the ethics and the methods that cell phones are forcing on us now. On the other hand, people have their cell phones wherever they go. I got called this morning by a bank in Oklahoma, and here I am in Israel and getting a sales pitch from a bank in Oklahoma. So it's a lot cheaper. I mentioned this. And the other choice is internet surveys. I get these all the time, and I suspect you do as well. I can't figure out how an internet survey is not going to be as or more biased in terms of who gets access to internet and who bothers to take the time and who, if they are on the internet, how come they're not answering their own email instead of taking your survey?
But cell phone has these pay-as-you-go numbers that bias the cell phone population.
Yeah.
Because you can't get them. So it's,
No, they're methods of kind of transferring people money back for their. I mean, people are experimenting. The problem is at different companies, but
I'm just talking about those who are buying
minutes.
the one-time phone that you use for
Right.
a few minutes, and then you phone it.
And the difficulty with those, of course, is that the numbers are there and then they're gone, and the sampling gets to be pretty complex. So I think, I mean, the cell phones are really changing this game, and we'll have to learn. And even since 2007, we did a last survey. Our survey research company now basically says you can't do this unless you have a strategy for how you're getting cell phone numbers, and is working on it. And it has almost tripled the cost for the calls to include a 30% sample of cell phones. So it's more complicated, and people are relatively protective of cell phone numbers and their time. So I just, coming here to social scientists, I said I had to, as a pediatrician, had to learn to think like a sociologist instead of think like a clinician. I'm learning that people will say amazing things over the phone to people, complete strangers, and are relatively unguarded when they're guarded in all kinds of other conversations. And so there are some real advantages to the telephone because they're not looking at you when they're answering your questions, and they're thinking about the question as opposed to thinking about whether you're going to think that they're a bad person. Murray Strauss and his colleagues have documented that, at least in the family violence surveys, people are amazingly in terms of what they'll disclose. And of course, the other advantage, you can dress in blue jeans when you're doing a telephone study. So, and samples can be larger than you'd normally get to. The distances become very small. I mean, you can do an international study now from sitting at your desk and collect it. And with voice over internet protocol, it doesn't even need to cost you a lot more to do surveys in different countries. And so companies like the Harris and Gallup poll have offices in Bahrain and other places and can do surveys. I was consulting with the Saudi government about doing a survey of children, and we had a discussion about whether it could be done by the Gallup poll organization's office in Bahrain, which obviously they speak Arabic and could do it from there, and that might actually be the cheapest alternative for how to do it because the Gallup poll organization are professionals that know how to do this and can do it pretty effectively. So things like this are still to be explored. Of course, the other things that you have to think about when you do this internationally are issues of access and gender and supervision and not putting people at risk and who can talk and who can't. But in some ways, in Saudi Arabia, telephone was people live in compounds that are a lot more protected with walls, and getting in and talking, going up to the front door and knocking and trying to do an interview there is actually complicated, and it may actually be the telephone is the way to bypass all the other protections that happen in terms of finding out what children are actually experiencing. And that may be similar in different communities here as well, that the telephone is something that can kind of get past the physical barriers in a way that you wouldn't otherwise get through. So you let your fingers do the walking. So questions or thoughts have you guys been involved in any telephone surveys here? Yeah, and they work, and people feel comfortable with them giving valid data?
We have an institute-wide unit that probably interviews about 80,000 people a year of different kinds and different samples. I mean, our samples here tend to be smaller. Research budgets are relatively smaller, but we have this computerized telephone system. Actually, we developed the software for us because we need the Hebrew and the English, and it's complicated, and we also in Russian and in Amharic, so multiple language. So we developed and adapted our own program, computer program for that, and so everything you're saying is very relevant to all our work. Yeah.
And have you tried family violence surveys?
What surveys?
Surveys of family violence or child abuse by telephone?
We have done, a number of years ago we did a survey of family violence. In some of our, you want to relate to our youth surveys?
We're also doing a lot of youth surveys, and there we were working in the schools with what do you call it, self-administration. So it would be totally anonymous because the child was in the class, and actually we got some pretty high reports of punishment. So it was among the youth. And now recently we've also done some work with internet. We're using the internet also in the schools and also with professionals. But not like a general public internet survey, but sending the questionnaire to specific people and asking them to respond through the internet. Through a not through the internet, through a how would you call it? Through a.
One of the advantages we have in the United States doesn't have that we can still go through schools. Do a self-administrated survey through school is something that is still very feasible in Israel and is totally not feasible in the United States. Because in the United States, you need, if you're even allowed, you need an active consent of the parents, and we still can do it with a passive consent of the parents.
If it's anonymous.
If it's anonymous, but you can still do it. In the United States, you cannot do it. So in weighting, the costs and the benefits, doing a self-administrated survey with kids in school, it's something we could still do quite easily, which in other countries is becoming hard.
So what I didn't talk about in great detail is our international survey work in terms of the ICAST instruments. But
we would also like to ask you to talk about the long scan.
All right.
And I'll tell you why.
That's the next session.
Yeah, but that's the next session, right?
Okay. Good. Yeah, we actually should probably. I guess we're due for a break, and then
we're
we
due
can.
for a break. We have refreshments, and
then we talk about the long scan. I'll just tell people so they would know why I'm so interested in the long scan.
Yeah.
The Central Bureau of Statistics in Israel started a longitudinal study, and as of 2013, they are going to include children aged 10 to 17 in the longitudinal study. So any experience we could learn about longitudinal studies in other places will be something very valuable for us. But we deserve a break.
Okay. Good. Thank you.